Hello and welcome to a very important discussion on belly fat that is affecting a big chunk of Indian population. I am 𝗗𝗶𝘀𝗰𝗃𝗃. What is of greater importance is that increasing cases of belly fat and obesity are leading to a growing incidence of diabetes in India. And this correlation between diabetes and obesity needs to be taken seriously, as India has often been called the diabetes capital of the world. India added more than 31 million new diabetes patients between 2019 and 2021, according to a study. Did you know that out of every 10 adults, one has type 2 diabetes? And 67% of the type 2 diabetes patients live with obesity. And this combination of type 2 diabetes and obesity or belly fat together increases the risk of other medical conditions like heart issues, kidney issues, liver issues, high BP, high cholesterol, etc. Also, it increases the chances of mortality. Today, I have a very renowned and well-qualified panel of doctors to discuss this issue with me. Dr. Anantharaman.R, he's consultant endocrinologist and diabetologist at the Magna Centers for Obesity, Diabetes, and Endocrinology at Bangalore. I also have with me Dr. Dheeraj Kapoor. He's head endocrinology at the Artemis Hospital, Gurugram. And I also have with me Dr. Sarmistha Mukhopadhya. She is additional chief health director at the B.R. Singh Hospital and Center for Medical Education and Research, Eastern Railway, Kolkata. Thank you so much, doctors, for coming to this show. So I'd like to start first with Dr. Anantharaman. What is the link between belly fat that is affecting so many people and the risk of developing diabetes in India?
So it's actually quite interesting. So when you look at BMI or body mass index, and if you look at waist circumference, so waist circumference is more correlated with the risk of getting diabetes than the body mass index. There may be some individuals, whose body mass index, that is weight divided by height square, is actually in the normal range. The normal range for BMI is 18.5 to 25. And we will all agree that that person is not overweight, actually. So, there's this common comment that comes, when you're in a social gathering, aapka weight acha hai, your weight is normal. Okay, that may not be correct, actually, because the waist circumference is what increases the risk of having diabetes. And unfortunately, more than 330 million Indians, I think, as per the latest Lancet survey, so more than 330 million Indians have a central obesity or a waist circumference larger than 80 for women and above 90 for men, actually. So this waist circumference increases the risk of diabetes manifold. For various reasons. The mechanism can be quite complicated. But when someone has, waist circumference more, that increases the risk of diabetes. They should be aware of this at least.
Right. I'll like to go to Dr. Kapoor for the next question. Why is the excess fat around our waist more dangerous than fat into other parts of our body?
So as Dr. Anantharaman said, that if you have belly fat, you have to have problems. The reason is that the fat may be in the belly region or in the peripheral region, right? The belly fat is the one which is around the viscera, the organs, the liver, the pancreas, upwards into the heart. Now, this is the one that secretes hormones which oppose insulin action, what we call the anti-insulin hormones. What does that mean? The insulin will not be able to have its full effect. So to compensate, what we call resistance. So to compensate, the pancreas produces more insulin, which means you are flogging your pancreas by the day. Pancreas, of course, we know, is the insulin producing factory of our body. So you are flogging the beta cells by the day. And once they get tired, in the common parlance, it is then that you get diabetes. Now, interestingly, in a diabetic patient, the insulin levels may be higher, I repeat, higher than the non-diabetic person, but they are not sufficient to overcome the resistance and the sugars begin to rise. So visceral obesity. Now, this is the reason why we Southeast Asians in general and Indians in particular are more prone to have diabetes as compared to Caucasians. We are smaller framed people, which means we have smaller pancreas, which means we have lesser beta cells as compared to them. And also, there is more resistance. So the body is facing a double whammy against insulin action and secretion, and that is why we are more prone. Of course, the BMI, as my previous speaker was alluding to, 18 to 22.9 is generally regarded as okay in our population, not the 25 bit which is there for the Westerners.
You've talked about insulin. I'd like to take the next question to Dr. Sarmistha. How does the belly fat increase the resistance to insulin and leads to type 2 diabetes, in your opinion?
Yes, that is a very pertinent question, I think. My previous speakers, I mean Dr. Dheeraj Kapoor and Dr. Anantharaman, have already explained half of it. In continuation of their explanation, I like to add that we must know what is the action of insulin and glucose in our body. That will make us clear, that will make us understand how insulin resistance happens. So we all know that glucose is basically the molecule which provides energy in our body. So what happens, how glucose gives us energy? It has to enter the cell, and for this entering into the cell, it needs insulin. So you can imagine in a schematic way, or in a very simplified manner, that if there is a closed door room, what happens if one person wants to enter the cell? He or she needs a key. He has to unlock the room, and then he or she has to enter the room. So what happens here? The cell is like the closed door room, and glucose wants to enter there. It needs to be entered there to provide ATP or energy, and insulin is that key hormone. So what will happen if we have more belly fat? We will have certain bad cytokines, the adipocytokines, which actually hampers the action of insulin. So insulin cannot let the glucose to enter the cell, so it cannot provide the energy which is required. On the other hand, what happens? The glucose is accumulated in the circulation outside the cell. So what happens? At one hand, it cannot provide the energy we require. On the other hand, it is accumulated in the cell and it damages different organs of the body. So you can easily understand that if insulin cannot work properly, if insulin resistance is there due to these bad cytokines, which is produced by the adipose tissue when there is belly fat, then what will happen? Glucose will not act and there will be insulin resistance. More and more glucose will be accumulated, and ultimately it will lead to type 2 diabetes. So it is in a very simplified way, and if we reduce our belly fat, then definitely this insulin resistance will come down, and the prevalence and incidence of diabetes will also come down.
Thank you so much, Doctor. I'd again like to go to Dr. Anantharaman. How does one identify that one has a diabetic belly? Because a lot of people are obese. How do they, find out the symptoms, or how does one make it out?
See, this is a very important question. So you have a belly and you know that it's a risk for diabetes, but how do you know that you have diabetes or not? The short answer is that you need to do the blood test actually. Okay. So there is no symptom per se of diabetes, which is reliable or sensitive. Okay. So for every 100 patients who have high blood sugar, it is estimated that almost 50% will not be even aware that they have diabetes. Okay. That's what the epidemiological surveys show. There have been like detailed epidemiological surveys done across the world, not only in India. It is not a characteristic only of Indians, or it is not a awareness problem actually. It is more of a biological problem. Like if your blood glucose goes up to 180 or 200, you may not even realize that it is 200. Okay. So some of the symptoms for the remaining 50% who become symptomatic, the symptoms include excessive urination or thirst when the blood glucose goes up. And also another symptom would be, burning sensation in your legs. Okay. So the burning sensation sometimes can be due to other conditions like a B12 deficiency, some other neuropathies can cause also. But this is one of the symptoms of the diabetes. And if the blood sugar is very high, it can also cause some blurring of vision. Frequent infections can be a symptom of diabetes, feeling very tired. So these are some of the symptoms of diabetes. But having said that, the only way to reliably check whether someone has diabetes is to do a periodic testing. So the recommendation is to do the test if you don't have any risk factors at least once in 3 years after the age of 45. But by definition, almost all Indians are at high risk of diabetes. The prevalence of diabetes in the urban areas in our country is already about 10%. Okay. So if you take people between 10 and 20 and 40 years of age, almost 5% people already have diabetes. Okay. So, and if you're above the age of 35 or 40, then your risk of diabetes, getting diabetes a priori, that is, we don't know anything about the patient. We don't know the family history. We don't know the, what is their waist circumference, what is their weight, etc. Without knowing anything, we can confidently say that if there are 100 people, 10% of them will have diabetes at the age of 40. Okay. So we should, the general recommendation is at least once a year, get your blood glucose tested. You need to test your fasting glucose, you need to do your post-meal glucose, and you need to do your HbA1c also. HbA1c is called 3-month blood glucose average. It's also a way to diagnose diabetes. Okay, so we need to get these tests done. Okay, in rare cases, we may ask for a glucose tolerance test or a GTT.
So that's good to be proactive in terms of preventing diabetes at the right time. Now I'd like to go to Dr. Dheeraj Kapoor. Sir, how do you think reducing belly fat would improve insulin resistance or insulin sensitivity, and that can also reduce the risk of developing diabetes in India?
Yeah, thanks. That is so important, because this would make us realize the importance of weight loss. What happens is that if you are obese, there is insulin resistance. My previous speaker explained beautifully by the lock and key mechanism. Now, we must understand that the belly fat is a surrogate marker of the fat accumulation in our viscera. The viscera being the liver, the pancreas, of course, the heart, the blood vessels as well. So once you lose weight, you lose belly fat, the fat from these organs also melts away, as it were. And the dictum is last to enter, first to get out. That is the dictum. So now let us look at the various organs and what happens there. So supposing you lose visceral fat, number one, you reduce the cytokines, the anti-insulin hormones, which means that the insulin in general would be able to act better. Number two, you give rest to the tiring beta cells, the insulin factory of our body. Number three, once the visceral fat goes down, which means that the liver also loses its fat. So the fatty liver, as it's called in common parlance, goes down. Now, what happens there? If the liver is fatty, there is insulin resistance, which means it is not under the control of insulin, as it were, and it makes more glucose, what we call the liver glucose output, in our language, the hepatic glucose output. So you reduce hepatic glucose output, which means that you reduce the fasting sugar levels. Second, the pancreatic fat also goes down, which means that to some extent, the insulin secreting capacity of the pancreas is increased. Number three, the fat around the heart, the epicardial fat goes down, which means the inflammation of the heart muscle. Subclinical myocarditis also goes down. So possibly your heart muscle begins to function better. And fourth, the fat in the blood vessels, the intima, that goes down. So the risk of atherosclerosis or the vascular blockages, as it were, also goes down. So what do? Number one, you reduce risk of diabetes. If unfortunately you have diabetes, you make sugars better, reduce risk of complications, and also cardiac disease is the major killer in diabetes. So you reduce the risk of cardiac disease as well. So just by losing belly fat, you get so much of benefit across the globe.
That's wonderful to know that reducing belly fat can reduce other issues as well. So how can we, do the lifestyle changes, Dr. Sarmistha? I want to know from you, what lifestyle changes do you suggest that can help in reducing the belly fat and further reduce the risk of diabetes?
Okay, very important aspect of diabetes management indeed. What do you mean by how does healthy lifestyle can help in management of diabetes? First of all, it can prevent diabetes who has not diabetes yet. Second, it can delay the onset of diabetes in those who have pre-diabetes. And also, you can prevent the worsening of diabetes in those subjects who are already diabetic. So definitely there are a vast importance of healthy lifestyle. So what do we actually mean by healthy lifestyle? So there are two pillars of healthy lifestyle. The first one is the healthy diet, and the second one is definitely the exercise which is needed. Healthy diet means actually there are a combination of certain foods like whole grains, which has low glycemic index or low glycemic load. Secondly, the low-fat dairy products, lots of fiber-rich foods like fruits and vegetables, lean protein, and also some amount of good fats, plenty of water. These are the do's which we should focus on these type of foods. And there are some don'ts, like we should avoid certain kind of foods like the junk foods, the sugary foods, the sweet beverages, the processed meats, and many other things, the saturated fats, etc. So these things we should avoid in our diet. Second thing is that exercise. Exercise is very important. It is said that 150 minutes of exercise per week is needed to prevent or to maintain our prevent diabetes or maintain our glycemic level. So these 150 minutes may be equally distributed, maybe alternate day, but there should not be gap of more than 2 days in a week. And this exercise should come as aerobic exercise like walking, running, swimming, cycling, etc. Or it may be resistance exercise. Both are important, resistance exercise and training. So first one, the aerobic exercise will reduce the fat and also improve our cardiorespiratory function. And the resistance exercise, they actually prevent sarcopenia. They will increase our lean body mass. So insulin resistance will be decreased. So both are equally important. Age of first life. So everybody is under chronic stress. So our stress should be reduced because stress can increase the counter-regulatory hormones and can increase diabetes. To reduce stress, meditation and yoga, they may be added, and that will definitely benefit to some extent. And definitely smoking should be avoided because they have so many metabolic complications and so many cardiac and lung problems associated with smoking. And also curtailing the intake of alcohol, because alcohol is basically non-nutritive calorie giver. Reduction of the alcohol intake will also benefit. So these are in nutshell the healthy lifestyle that can prevent or worsen diabetes.
Great. Dr. Anantharaman, a lot of people are pre-diabetic. So is it possible to reverse pre-diabetes by targeting and reducing the belly fat through methods like diet and exercise?
I think Dr. Sarmistha has given a fantastic account of what all should be done to overall improve health. But when you want to focus only on diabetes, the biggest benefit of weight loss and exercise is going to be on diabetes prevention itself. So there have been very good scientific studies done in this area. So which show that almost 80% of the diabetes which is going to happen can be prevented by intensive diet and exercise, like what doctor has told just now. So it's not that, despite doing the diet and exercise effectively, we will not be able to prevent diabetes. That's not true. Over a 5-year period, if you carry out everything that has been told and reduce your body weight by between 5 and 10%, almost 80% of the diabetes can be prevented over the 5 years. Okay. So why it is not preventable 100% is a important question. So partly it's due to aging also. And also another thing is, the body does not respond so much to diet and exercise as you become older. So, and paradoxically, the finding was that, even in the older people, the diet and exercise actually worked better than younger people in the diabetes prevention program. But one of the reasons could be, as you are trying to reduce your weight and, you are exercising regularly, but then you may find that the blood glucose is actually rising despite your best efforts. That can also happen. That does happen in 20% in real life. So why does that happen? That happens due to aging actually and your genetics. So once you are able to do everything and still the blood glucose is not controlled, we obviously have very good, excellent medication. Okay. So when someone takes medication along with good diet and exercise, then they will require very minimal medication. They won't require a lot of medication. So this is the best way to manage diabetes. So once you do this, then the side effect of medication is reduced. Okay. And you require very less medication also. Cost also comes down. So we should go all out once you are realize that you're pre-diabetic or having abdominal obesity, to make sure that you reduce weight, increase your exercise, and adopt a healthy lifestyle. Okay, so there's no substitute to that, because it will buy us almost 10 years of time. So what I tell my patients is 10 years may not seem like a lot to you now, but actually 10 years is 15% of an average lifespan. Okay, so if you do 10 years of diet and exercise in your middle age, say you start at 30 years and do it till your 45th birthday, 50th birthday, 20 years you do, your best years of life, you can live without any, worries or threats of chronic diseases, actually.
Right. Dr. Dheeraj Kapoor, how does a person's waistline measurement serve as an indicator of the potential metabolic and diabetic risks?
Okay, so waistline, again, a surrogate marker of belly fat, again, that of visceral fat. I'm not here to mention technical terms, but studies have been done that as compared to Caucasians, we Indians have more belly fat for the same body mass index, which is the marker of weight upon height squared in meters, as my previous speaker was alluding to. Therefore, BMI may not be a very interesting or important marker in our context, although it does give us some hints. Now, the waist circumference was believed to be less than 102 centimeters in males and 88 in females. But in Southeast Asians, that does not hold true. Because we have so much of belly fat, we are smaller framed people. So it should be 90 centimeters or less in males and 80 centimeters or less in females. So there, the importance of genetics also comes into account. Waist-hip ratio, again, could be a better marker. So in women, less than 0.8. 0.8 to 0.84 is fine. More than 0.84 is bad. For men, again, less than 0.9. Then 0.99 is at risk, and more than that is obese. So in Indians, we have lesser because we have more of belly fat, smaller pancreas, and we Indians have a molecule called triglyceride, which is higher. That makes our body lipid profile more cardiac harming, or we call what atherosclerotic lipid profile. And that is so very typical of people in Southeast Asia. So by reducing belly fat, particularly the waist or the waist-hip ratio, if we improve that, even if we don't improve the BMI, because mind you, if you exercise vigorously, you build up on the muscle mass, you lose the fat mass. We know that the muscle mass is more dense than the fat mass. Sometimes the weight may increase, but that's a good way. You are preventing sarcopenia. You're improving your muscle mass. So that improves the insulin sensitivity and the blood glucose disposal into the muscles. So the blood glucose doesn't rise. So exercise and thereby losing belly fat is important. We must also understand that we should not blindly go by the Western data. We have our own data. We have our own markers. We have our own values for waist circumference, the BMIs, all of that. So that should be the guiding force rather than the ones which have been given by the Westerners.
Right. Dr. Sarmistha, what in your opinion are the common myths surrounding belly fat and its connection to diabetes that people shall be generally aware of?
Okay, naturally, every chronic disease has got some myths, and diabetes is so prevalent in all over the world and also in our country that definitely certain myths are associated with it. So first of all, I think Dr. Kapoor has very nicely explained the first myth, and also Dr. Anantharaman, that the definition of obesity itself is a myth, because most of the people think that weight is the best marker of measuring obesity, but this is not. A 6-foot person and a 5-foot person cannot have the same weight. Second, who are a little bit more aware, they think that BMI is the definition of obesity, but that is also not the accepted thing. Already it has been explained that a bodybuilder and a short, plump lady may have the same BMI, but one has the lean body mass, the muscle mass, which reduce the insulin resistance, and the other has the belly fat, which increase the insulin resistance. So definitely BMI is not important. Rather, our body composition, our waist circumference, that is important. That is the first one, the definition of obesity. So there are certain wrong myths about the definition of obesity. The second thing is that has also been discussed. I am just summarizing that in Indian subcontinent, people think that we are lean, but we are actually not lean. We may be apparently lean, but we are metabolically obese, because we have thin limbs and leans, but we have truncal obesity, we have belly fat. So even if we have lesser weight, small frame, but we have more, we are more prone to this insulin resistance and diabetes. And Dr. Kapoor has already explained that our cutoff for waist circumference is also for less for Southeast Asians, particularly the Indians. So that myth should also be overcome. And the third one is that people think that only diet or only exercise can overcome this insulin resistance, but both are equally important. Next is that the fatty food, all fats are not bad. That should also be kept in mind, because there are certain the foods containing omega-3 fatty acids. All the calorie from the fat, calorie from the nuts or avocados or something like that, they are not good fats. So balanced diet is more important. And the last but not the least, I want to mention that figure or cosmetic importance is not the priority, should not be the priority for reduction of belly fat. So we should bank on the exercise and healthy diet. These things these myths should be overcome by more and more public awareness program, so that we know the reality, and our knowledge should not be based on the myths, but on the facts.
I think well said, and you summarized well that for reducing belly fat, cosmetic measures should not be taken into course. And this discussion has actually busted a lot of myths. It's given eye-opening information that reducing belly fat is more than a cosmetic concern. And we all need to be more conscious, because Indians are made in a way that they're more susceptible to diabetes and obesity. Excess fat around the waist can be easily managed through lifestyle changes, through diet, through exercise. And we hope that our audience got some very important takeaways from today's very valuable discussion with our esteemed panelists. Thank you so much, Dr. Anantharaman, Dr. Dheeraj Kapoor, and Dr. Sarmistha, for sharing your time with us and sharing this very important knowledge that would help people in mitigate the development of diabetes in India. Thank you so much again.
Thank you so much for having us here.
Thank you.
Thank you.